everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a June 29th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 28 new COVID-19 cases since my last update on Thursday and no new cases since yesterday. As of June 29th, Dubuque County has 501 positive COVID-19 cases. No additional deaths were reported, so a total of 22 deaths remains in Dubuque County. About 5% of the just over 10,000 people tested in Dubuque County have been positive. 4 individuals are currently hospitalized, and 257, or about 51% of Dubuque County positive cases, have recovered to date. The state added 291 cases since yesterday. As of June 29, 2020, Iowa has a total of 28,780 positive cases. In all, about 1 in 11 Iowans, or over 300,000 people, have been tested. That's about 10%, and 10% of Iowans tested have been positive. 3 additional deaths were reported in the state for a total of 708 Iowans. And currently, 119 cases are hospitalized, which has been decreasing around the state. And finally, about 62% of Iowans have recovered. So I continue to receive questions regarding what does recovered mean. Recovered numbers that you hear from me every day come through the contact tracing process. At the end of an isolation period for a positive COVID-19 patient, they are contacted by the Iowa Department of Public Health contact tracing staff to assess their symptoms to see if, number 1, they have been fever-free for at least 3 days or 72 hours without the use of fever-reducing medications. 2, their symptoms have improved, whether it was a cough, shortness of breath, or other respiratory symptoms. And 3, at least 10 days have passed since the symptoms first appeared. For persons who test PCR positive, or the viral testing, but do not experience symptoms, recovered means that they isolate until at least 10 days have passed since the date of their first positive test, and they continue to have no symptoms, cough or shortness of breath, etc., since the test. So if all these criteria are met, a person is considered recovered. Currently, 45% of positive cases in Dubuque County are in the 18 to 40-year-old age group. As I mentioned last week, during the month of June, the majority of cases reported across the state have been in this category. So what does that mean? It could be that this age group is attending community events and activities more as restrictions have been lifted, which exposes them to more people. Think of how many in this age group may be participating in group sports or community activities, or have family members who participated in community or organized sports activities. It could also mean that many of these positive tests were tested as a result of being in close contact with a positive case. It could also mean some asymptomatic individuals were tested at the Test Iowa site at our Dubuque site offered at Epic Health and Wellness Clinic to just be screened, with or without the knowledge of exposure or symptoms. It could also mean some positive cases were experiencing symptoms, such as fever, cough, or respiratory symptoms, and saw their doctor or healthcare provider and were tested. Since more tests are now available, private clinics, hospitals, and the Crescent Community Health Center are all testing patients if they are symptomatic. There are a lot of factors to consider as we watch our Dubuque County 14-day trend line continue to increase. And remember, this 14-day trend line is posted on both the City and the County of Dubuque websites on their COVID-19 pages. So what about the asymptomatic younger adult who never gets sick with COVID-19 disease? Why aren't they getting sick, hospitalized, or even dying at the same rate we've seen in other age groups? We don't know the definitive answer to that, but we do know that younger adults have stronger immune systems and generally less underlying health conditions and/or fewer chronic diseases, which makes them less susceptible to developing illness or severe illness. Younger adults, or all those in the 18 to 40-year-old age group with underlying or chronic health conditions, should be extra cautious with physical distancing, hand washing, mask wearing, and limiting exposure to groups and crowds. These are definitely contributing factors. But until more research on the data behind these younger cases happens, we won't know for sure. Thanks for tuning in today. It's a hot one, so stay cool. Let's all continue to be safe and practice proper public health measures. Keep in mind, the more closely a person interacts with others and the longer that interaction, the higher the risk of COVID-19 spread, whether or not they have symptoms. And remember, we're all in this together, so each of us should continue to do our part to mitigate the spread of COVID-19.